Why is a CORT scan used for colorectal health? Have you ever wondered why a computed tomography scan, often called a CORT scan, is an important tool for colorectal health? This imaging technique, especially when used as CORT colonography or virtual colonoscopy, plays a vital role in screening for polyps and colorectal cancer. It provides detailed images of the colon and surrounding tissues, allowing healthcare providers to spot abnormalities like polyps, tumors, and lesions. These findings can indicate early-stage colorectal cancer or precancerous conditions, which is crucial for timely intervention. One of the standout features of CORT colonography is its ability to create high-resolution two-dimensional and three-dimensional images of the colon's interior lining. This level of detail helps visualize polyps and lesions almost as clearly as traditional colonoscopy. Early detection is key in improving outcomes for colorectal cancer, making this imaging method incredibly valuable. Another benefit of CORT colonography is that it is non-invasive and does not require sedation. Unlike conventional colonoscopy, which involves the insertion of an endoscope, CORT colonography is more comfortable for many patients. This means they can return to their normal activities right after the procedure, which is a significant advantage. Additionally, the risk of complications with CORT colonography is much lower compared to traditional colonoscopy. For example, the risk of colon perforation, which is a tear in the colon wall, is significantly reduced. This makes CORT colonography a safer option, especially for patients who have higher risk factors or other health conditions. CORT scans are also useful when a colonoscopy cannot be completed. If there is bowel narrowing, obstruction, or if a patient is intolerant to the procedure, a CORT scan can still provide valuable information. It can also be performed when sedation or endoscopy poses increased risks, such as in elderly or frail patients. Moreover, CORT colonography has the added advantage of detecting abnormalities outside the colon. It can identify early-stage cancers in other abdominal organs and conditions like abdominal aortic aneurysms. This comprehensive diagnostic capability contributes to a thorough assessment of abdominal health. The procedure itself is quick, taking about 15 minutes, and is generally less expensive and easier to schedule than traditional colonoscopy. This accessibility can improve screening adherence, which is essential in the fight against colorectal cancer. While CORT scans use X-rays, it is important to note that no residual radiation remains in the body after the scan, and immediate side effects are rare. In summary, CORT scans are a safe, effective, and less invasive method for detecting colorectal polyps and cancer, especially when traditional colonoscopy is not an option. They also provide valuable insights into other potential health issues outside the colon. However, it is essential to remember that colonoscopy remains the gold standard for screening and diagnosis. CORT colonography serves as a complementary or alternative tool based on individual patient circumstances. Always consult with healthcare professionals to determine the most appropriate screening method for your specific needs.